Good morning. Today we'd like to take a class in PHE for jss2 class. Topic is posture, subtopic posture and postural defects. We'd like to consider the following objectives. At the end of the lesson, the students should be able to list, define posture, state the kinds of posture, should be able to state the correct posture for standing, sitting, and walking. Should be also be able to state what postural defect is, and then at least mention some few types and explain. So what is posture? Posture is the way the body is held while standing, sitting, walking. It can be defined as the alignment or the adaptation of the body while we do our everyday activities. So this is an illustration of standing, sitting, and walking posture. Let's go into it. So the kinds of posture, we would like to consider first of all the sitting posture. How are we supposed to sit correctly? So you can see the wrong person doing it, sitting with the back curved in. So the right posture while sitting in should be to always make sure your back is at least touching the chair and your spine is straightened up. Straighten back by bringing the straighten up. So this is the right posture for sitting. And then the next one we like to see is the correct way to stand. So while standing, what is the right posture to maintain? The position should be easier, not forced. It should not be rigid, it should be flexible. The head should be well up. The chin slightly draw in, the back of the head and the knees should be in one straight line. The shoulders should be held back in their natural position with the chest forward and the abdomen in the heels together The weight of the body should rest on the outer legs of the feet. The arms should hang easily and at the sides with the palms turned inward and the fingers slightly bent. The next type of posture we like to see is the walking posture. How do you walk correctly without having a postural defect? When we maintain a wrong posture in walking, we always develop a kind of postural defect. So to avoid this, we need to learn how to walk correctly. So while walking, this is how you should walk. You should avoid bending a little bit backward, like the first person that is doing it wrong here. You can see that there is too much curve inward from the person at the back. The back region is curved, and this making the chest to be upward. The second person is doing quite the opposite. You can see that the curve is a bit inward, flattening the stomach and forcing the shoulders to go backward. But look, the last illustration here shows the right posture for while walking. So you maintain your spine, your head held straight and either side of your body not curved inward. Running is another kind of posture we need to look at. While running, it is very important that we take note of how we land. If you take a look at the feet to see how they're landing, we should not land like that. We should not land at the edge of our sole. We should land straight, or better still, land flat. Next kind of posture is the sleeping posture. Sleeping posture, a lot of us would like to sleep differently. Some people would like to sleep forward, some bend down, back, some like side, some they like to sleep face down. So you can see the first illustration, somebody who likes to sleep forward, but he's having a pillow that is a bit very hard and it's making the neck to hang in the air and the back is curved in. So to correct this, you can see pillows are used to correct this. So if you have only one pillow, or you have pillows that are too hard, it's time you change it. And the other lady sleeping back facing down, her spine is bent inward and this might cause back pain when she wakes up. So to correct this, you need a pillow right in front of you, in front of your abdomen before you sleep, and you need a soft pillow to avoid her head hanged as it was in the first case. The next one is people that like to take it sideways kind of sleep. You have to look for a pillow that will complement your abdomen as well as your neck region. to be flat with your body. So this is the right posture to take while we are sleeping. So let's go to postural defects. We've discussed some kinds of posture already, so let's take postural defects. So postural defect refers to an abnormality or misalignment in the body's position. We already know that posture is the position in which our body are held while we sit, stand, and lie down. So let's go into different types of postural defect. The first type we want to look at is knocked knees. Knocked leg knees is when your patella is a bit curved inward. It falls inside the anterior leg, making your leg to take a K type of shape. It's also known as K leg actually, and it's actually the opposite of the next one we're going to discuss, which is what the bow legs. Here the patella doesn't fall inward. The bow legs are condition in which the legs appear bow, like arrow and bow, so it appears curved to the outside. In a bow leg situation, the patella would fall to the outside of the anterior leg. You can see the illustration of a normal leg, and you can see that in the bow leg situation there is a very huge curve, a very huge space between the legs because of the outward bending of the patella. You can see the skeletal framework as well, how it has curved outward to make this type of formation. This bow legs and K-leg are all results of faulty formation of the skeletal system, faulty development of the skeletal system. Next one is lordosis, which is also known as sway back. It attacks the downward region of your back. It curves in, giving you to have a very huge abdomen, protruding abdomen. So lordosis is defined as the abnormal curvature of the spinal column. This is the backward bending of the spinal column of the body. The tummy or stomach is usually very big. Next is wry neck. Wry neck is a critical condition which in most cases is caused by accidents. Other causes of wry necks include the muscle strain, muscle spasms, injury, nerve problems, infections, genetic predispositions, rare, and sometimes we have rare causes where the neck limits of flexibility of movement is restricted. So it's a condition in which your chin is bent to the other direction and your head is also tilted towards the opposite direction. Next type of postural defect we want to see is scoliosis. Scoliosis, for you to understand different types of scoliosis, we have to take a look at our vertebral column of the spinal cord. Here we have all the parts shaded out for you: the cervical region, the thoracic region, the lumbar region, the sacral region, and coccyx region. So for you to be able to tell a doctor I have this type of scoliosis, you need to understand where the curve is. Scoliosis is the lateral curvature of the spine that is the sideway bending of the body. So you have to know which side is bending. So if it is bending at the upper part, the thoracic region, you tell the doctor you have a thoracic scoliosis. Is bending down the lumbar part, you tell the doctor you have a lumbar scoliosis. And in some cases where you have a joint lumbar and thoracic curve that is sideways, you tell the doctor you have a thoracolumbar scoliosis. And the last one is combined, where they are separately in different regions of the spinal cord. Next is a very easily managed type of postural defect, in a way that a lot of people will not really notice or see this, because most people wear the shoes around. But you know, normally a human feet is always curved in. It's always curved in. It's a bit, it has a curvature, but you can see the wrong alignment here in this illustration, you can see that the man's has a flat sole from the edge of his sole to the tip of his last toe. He doesn't have much of the curve. It's absolutely not even visible. So the next one, which is also known as hunchback, is what we call kyphosis. Kyphosis is regarded as round shoulders, which involves the bones and the muscles of the back to assume a hunch or humped condition. You can see here the illustration shows the right normal spine, how it should look like, and in case of a kyphotic situation, you see the back is a bit humped or hunched to the outside. This bending is different from lordosis in a way that it is not bending inward, it's bending backward, and it's not sideways as in the case of scoliosis. So we have a few assignments here for you to do, some few questions. We first define posture with your own words, state the types of posture, then you state the 3 types of postural defect, and you can challenge yourself further by mentioning the parts of the spinal cord that were briefly touched while discussing scoliosis. So goodbye for now, just have a lovely day. And here is the message for you. It says, train your body, challenge your limits, and transform your life. Goodbye.